On October 6, 1892, the City of Pasadena Board of Directors established the Pasadena Board of Health. During their first few years, the Board of Health, as the department was called at the time, focused on creating a strong foundation for the operation and impressively tackled complex public health concerns, including establishing a plan for providing health care to indigent populations, promoting the need for a closed sewer system, and guiding the community through both a cholera scare in 1892 and scarlet fever scare in 1893. Over the last 130 years, the Pasadena Public Health Department has continued our efforts to protect the Pasadena community from a wide range of public health challenges and concerns.
Since the 1890s, the Pasadena Public Health Department has been working to preserve our community's health and well-being. Established October 6th in 1892, our population was less than 10,000 people. Then, we were only designated as a Board of Health, with plumbing and building inspectors making just $12.50 per month. We've moved on and changed with the times. In the early years, prevention of tuberculosis, a disease that caused 50% of all mortality in the United States, was our high priority. We focused on milk testing and infection control standards in our food production. Pasadena was a pioneer in raising standards for milk control, and we were the first in the state of California to successfully enforce that only milk tested for tuberculin be sold. Our department worked to create ordinances to prevent the spread of typhoid, smallpox, and diphtheria. All vaccine preventable now, but at the time, caused for great concern in Pasadena. Waterborne diseases used to be heavily prevalent, and it was our department that was the first in the state to require our water reservoirs be covered. Much like our response to the COVID-19 pandemic, the Pasadena Public Health Department was heavily involved in the 1918 influenza pandemic, responding to more than 4,231 cases. Our health department has a long history of working with people in communities in need and being pioneers when the times were changing. When our population was just getting established, our health department offered free home births performed by our city health officer, and we were central to opening a 3-bed community hospital in 1920. At the time, our public health nurses performed health visits for children, prenatal clients, offered venereal disease treatment, and outreach and hygiene classes. In 1926, we began to require all food handlers hold a health certificate. In 1932, during the Great Depression, our PHNs, in what would later become our Women, Infants, and Children program, distributed milk to supplement the diet of our community's children. In 1959, our city health department was the only city monitoring drinking water, air, and rainwater for radiation due to nuclear testing. In 1972, our health department discontinued their smallpox vaccine clinic, and only 5 years later, smallpox was declared eradicated from the world. At our 100-year anniversary in 1992, the city was lauding our aggressive and compassionate response to the HIV/AIDS pandemic that was killing millions of Americans. We also relocated ourselves. We celebrated our move from Pasadena City Hall to our location now where we are in Northwest Pasadena. We intentionally co-located ourselves with an organization then known as the Community Healthcare Alliance of Pasadena, now known as CHAPCare, and also opened our very own HIV/AIDS clinic called Andrew Escajeda in 1991.
In epidemiology, we look to these historical trends to build upon areas for improvement. Efforts over the last century have built a healthier community than it was in the 1890s, and we will continue to use data and trends to help protect, maintain, and improve the health of Pasadenans. Epidemiologists are often called disease detectives because we investigate the cause of disease, identify people or communities at risk, and determine how to control or prevent poor health outcomes through interventions. Epidemiologists provide the backbone for evidence-based health interventions, providing data that is actionable in our community.
One of the core functions of our EPI program is to evaluate the records of our births and deaths, which we do in partnership with our Vital Records program. The purpose of the Vital Records program is to maintain birth and death records. A birth record is one of the most important documents because it proves a person's identity and is necessary to apply for essential government documents, such as a driver's license, a passport, or a social security card. Obtaining a birth or death record can be some of the happiest or worst time of our lives. How we die is an indicator of how we lived, good or bad. We use birth and death record to look at the factors that result in a person's passing and identify disparities in deaths, such as age, gender, and race ethnicity. This analysis informs interventions to increase life expectancy and reduce the root causes of death. In 1890, the leading cause of death was tuberculosis and pneumonia, and in 2021, the leading causes of death and premature death was COVID-19. What a sign of our times.
To better understand the health needs and outcomes of the community, we lead Community Health Needs Assessments, or CHNAs. The CHNA report presents findings from a systematic analysis of health indicators that also include demographics, social determinants of health, and data from our maternal and infant health assessment, which surveys new parents on parental and infant-related experiences and behaviors. The CHNA provides an update to our community on the health of the population, key health disparities, and resources available to improve health. It also informs and becomes the baseline for community health planning and other interventions aimed at health equity.
Another vital function of our work in epidemiology is disease control and surveillance, which we conduct with our partners in disease case investigation. We identify trends in infectious diseases and risks that might increase a person's chance of being exposed, which are then summarized in our communicable diseases report, along with prevention strategies. As epidemiologists, we are proud to provide enhanced surveillance and support for diseases of special concern, including HIV and modern global health emergencies, H1N1, COVID-19, and Mpox. During the COVID-19 pandemic, our surveillance of cases and analysis of this data helped inform policy and health officer orders, outbreak management, vaccine planning efforts, and other educational outreach to the community.
This department is quite a large unit. We have a wide-ranging programs, everything from the maternal and infant child health program to the tuberculosis prevention program and my personal program, communicable disease. And so in all of these programs, we have a lot of opportunity to work directly with our community, and that includes working with our key stakeholders, which includes our schools, our businesses, our local medical providers, all the way down to working directly with individuals.
Communicable diseases get reported to us here at Pasadena Public Health, and it's up to myself or other individuals on my team to reach out to the infected individuals and basically figure out the who, what, where, when, why, and how. And through those investigations, we help control the spread and infection of communicable diseases. We help get people treated. We educate them on preventing infection so that we can keep our neighbors, friends, family safe. And overall, we just improve the expected health outcomes of the folks here living in Pasadena.
We are recognized on a much broader level thanks to the COVID-19 pandemic, and that has given us really a spot on the map for many folks who didn't know we were here. So we're really hoping that there'll be more innovation in how we're able to reach out to the public, provide education to the public, have rapid, quick responses to emerging communicable diseases and emerging conditions that impact the health of the public.
So the MCH program services have changed quite a bit, I think, since the program first started 30 years ago. In particular, our Black Infant Health Program, which was started in the early 1990s and really focused on Black mothers and children's health and really prioritized their health, which I think was really critical because they are known to be 2 to 3 times more likely to die from childbirth complications than white women. We've kind of focused less on providing direct services to families and really focusing on connecting families to providers. So building partnerships with prenatal providers, with pediatricians, and connecting moms and children to the many wealth of resources that are available in Pasadena.
Some of our parents came in with little information, they're first-time moms. So I think by participating in our group model, they became empowered, they found their voice, they were able to advocate for themselves and their families, and also make sure that they work towards having a healthy birth outcome and practice healthy lifestyle changes.
There are other services that we can provide to families, and one of them being oral health, as oral health is a big impact in a lot of our communities, and it could feel that oral health is so unattainable because it seems either expensive or hard to get access to. And as the oral health program, we want to be able to provide preventative services so that families don't have to feel like they need to go to the emergency room or go when their teeth actually hurt to the dentist because that's when they need more work. So we want to be able to advocate for them so that they can advocate for themselves in oral health.
WIC provides meaningful intervention for prenatal mothers, which acts as a precursor for great health and nutrition for children ages 0 to 5. It's all about prevention. We're providing health education, nutrition education, and in turn this trickles down to future generations. We have lactation consultants on site. We have a little by little reading program for our youngest participants. There's support at every level, and you can take classes online, in person. We're here to assist all participants with their goals. They are really the agents of change, and we're merely the guides.
So the Nutrition and Physical Activity program, what it does is really centered on its mission. And the mission is to make sure that we reduce the prevalence of obesity and other chronic diseases for the city of Pasadena. And so in order to do so, we offer 2 different ways that we offer to the city essentially. So the first thing that we do is that we provide nutrition education and physical activity classes free of cost for pretty much any age, from all the way down to little teeny tiny toddlers all the way up to seniors, to making sure that we have the most inclusive population as possible to teach them how to eat healthy and how to move their body. So the Healthy Retail program really has identified Northwest Pasadena as an area in which to eliminate these food deserts. So food deserts identified as anywhere between a half-mile radius in which folks are not able to access food. So we're helping out 3 different corner markets, local bodegas. And so one is an Argentina market, which is located on Villa Street. We have Lake Avenue, and then a corner market as well. And so what we have done, and I'm proud to say, is that we actually are able to provide them with brand new refrigeration, so they're able to actually provide fresh produce and veggies and all that good stuff to the community.
Lead-Free Homes Pasadena engages our community by providing free lead paint testing. So we test a home for any lead paint content, and if anything is found, we do all the remediation, the repair work, and the repainting, all 100% free of charge. It's covered by LA County through the City of Pasadena. Promoting health equity is key to what Lead-Free Homes Pasadena does. We ensure that we are targeting traditionally underserved communities within Pasadena, and that means identifying certain socioeconomic factors. That means that we can reach out to these communities that have traditionally not been served or haven't had equitable access to the programs the Public Health Department has.
We have flyers in English, Spanish, Korean, Vietnamese, and Chinese. And we also have staff who speak multiple languages that can assist with the application process as well. Lead-Free Homes is a wonderful asset for the Public Health Department because it allows us to serve our community in a way that removes a financial and a health burden away from them.
The Tobacco Control Program has been providing services to the City of Pasadena for over 30 years. It does that through prevention education, outreach and community events, and policy development and promotion. On November 2021, the City Council unanimously voted to ban the sale of all flavored and tobacco mentholated products. And so the signs include the new updated PMC version, which includes the definitions to align with the state and federal definition of smoking. The city has over 10 codes that focuses on smoking prevention and education. Some of them include multi-unit housing and indoor-outdoor smoking regulations.
The Geriatric Empowerment Model is a program or model that provides supportive services to people that are 60 and older that are unhoused, living in the Pasadena area. Those supportive services are intensive case management services, housing navigation services, which is to stabilize housing, as well as linkages to mental health services and other resources within the local community. It is critical to integrate services such as the Geriatric Empowerment Model into the Public Health Department. It reduces the disparity by allowing people to get connected to housing, stabilized through their mental health.
The TALINK program connects young adults ages 18 to 24 experiencing homelessness or at risk of experiencing homelessness to case management, housing navigation, and other concrete supports like clothing, food, and gas. We strive to help youth regain a sense of control in their lives by providing education about resources related to mental health, physical health, housing, substance use, education, employment, and more. TALINK partners with other youth agencies in the area to ensure that we are collectively providing a quality level of attention and care to our unhoused youth. In addition to providing linkages and case management to our youth, our community ambassadors serve as peers for our clients, and they also provide essentials to people living outdoors, regardless of their age. During street outreach, our ambassadors provide food, water, snacks, hygiene items, and resources to people experiencing homelessness. Their goal is to build relationships with our unhoused community members over time.
Pasadena Outreach Response Team, also known as PORT, My main function with the team is to outreach to individuals that are experiencing homelessness, to address the issue of mental health and substance use, and try to navigate them to get off the street. So they'll call our team, which is extensive case management, and we have the resources to get people into detox, into rehab, and psychiatric, and also medical and dental appointments. So they reach out to us first before they do anything.
One of our biggest things that we do is advocate for our clients, whether if it's in the court, whether if it's for jobs, whether it's for housing, or anything else. We advocate.
It can happen to anybody. I'm working with an individual who had his life together, had everything. He had, a kid, he had a wife, and just had a horrible accident in his life. And it was something that maybe a lot of people can recover, but he couldn't recover. I've had to learn there's a lot of trauma in people's lives that they just can't deal with it. And it starts with the mental health, and the next thing you know, they're on the streets.
It really depends on where they are in their point of life. If they want services, we are there for them, and if they don't, then we'll keep on trying until it's time for them.
Environmental health specialists are workers that enforce California laws to protect the public's health. We help ensure that the food we eat, the water we drink, and even the public pools we swim in are safe. And we use a combination of education and enforcement to help protect the public health. The different types of facilities an environmental health specialist inspects include restaurants, grocery stores, gas stations, public pools, and even tattoo shops. During a restaurant inspection, we focus on the things that are most likely to get someone sick. So we look at hand washing, we look at food temperatures, we look at the sanitizer, and we want to make sure that the food is coming from an approved or safe source.
Most recently, public awareness has focused on our response to the COVID-19 pandemic and high community vaccination rate.
For over 20 years, the department has prepared for potential public health emergencies by planning and exercising emergency functions, including communicating with all Pasadena residents and offering medications and vaccines on a large scale. This preparation was key to providing over 1,500 COVID-19 vaccinations a day during the pandemic. In a public health emergency, the health officer has legal authority granted by the state of California to issue health officer orders and public health guidance necessary to prevent the spread of diseases.
Our division has focused on the COVID-19 vaccination effort. Throughout our effort, we have held hundreds of mobile vaccination efforts. We continue to vaccinate at this time for anyone looking for a primary dose series, as we are preparing to administer our up-and-coming bivalent booster and our seasonal flu vaccines.
So when the pandemic first began in March 2020, all city employees answered their call as disaster service workers to be part of the response effort. For many city employees, that meant the continuation of providing the essential city services that we provide each and every day. But for some city employees like myself, it meant taking on an entirely different role. And I actually had the pleasure of working with and for the Pasadena Public Health Department for about a year and a half as part of their Emergency Operations Center for the COVID-19 response. In addition to working on some of the communications and messaging, I also helped with the vaccine planning and implementation, and also served on the school's technical assistance team, which was focused on resuming in-person school instruction again.
Something that I and a lot of us are very familiar with was the employment of contact tracing with the COVID-19 pandemic. By identifying close contacts, you can help them quarantine. You can help them get tested if they do develop symptoms. You can educate them on what the symptoms are in the first place. And then as the pandemic progressed, we were able to identify individuals that maybe hadn't been vaccinated that were still on the fence. And post-exposure, we could reach them, educate them, and get them properly vaccinated and protected against this very deadly communicable disease. So contact tracing is one of the oldest tricks in our book, and it works.
Well, the public library was supportive to the public health department during COVID-19 by sending, I believe, over 15 employees to public health to conduct contact tracing, to conduct data entry, data integrity, and it sort of expanded from there. beyond contact tracing as well. I know that I personally worked with the nurses and worked with the skilled nursing facilities and the assisted living and congregate living facilities in Pasadena.
During the pandemic, it became clear that the health department was that link for all of these various partners, including within the city. As an example, Huntington Hospital, private medical providers, to ensure that all residents in Pasadena had the information that they needed to keep themselves and their families safe, even in their own homes. The health department also partnered with the city and all of these various partners to help businesses operate safely during the pandemic.
But the department has a long history protecting the Pasadena community from other serious infectious diseases, such as the pandemic of 1918, polio, and tuberculosis. And through public health promotion programs such as food facility inspections, nutrition education, immunizations, and support for expecting and new moms. Over the course of our nation's history, there have been difficult times where the field of public health and government in general did not always serve marginalized communities equally or well. This history has had lasting impacts on community health and trust, but acknowledgement alone is not enough. We are committed now more than ever to improving our approach to serving residents and their families, friends, and neighbors. Wherever our predecessors failed to serve the needs of our diverse communities, our current public health workforce embraces the responsibility to do better.
Our commitment to health equity program is really focused on advancing the health and well-being of all in Pasadena. We're actively seeking out diverse perspectives to really gain a further understanding as to what's happening in the community, learning from the community's lived knowledge in the process while acknowledging the past harm and neglect that they've faced along the way.
Unfortunately, these health inequities have been around in Pasadena longer than the public health department has been around. We've known that even though the city itself has long been seen as one where people come to for health, there have always been people who haven't done as well or been as healthy as others in the community. So it's something that public health officials have long been trying to wrap their heads around, but we now are really deciding that in order to really address them head on, we need to know what they are, investigate them, and try to address them with targeted solutions.
Over the last 2 decades, growing inequality and health disparities have caused the field of public health to reflect on its approach for addressing contemporary public health issues. With the emergence of tools like the county health rankings, we have access to more data about the conditions that make a person's zip code a stronger determinant of health than their genetic code. With an improved understanding of the relationship between social conditions and health, the field of public health has shifted its focus upstream to address these conditions, from education to safe environments, housing to transportation, economic development to access to nutritious foods, and more. These conditions, or social determinants of health, reflect the circumstances in which people are born, live, work, and age. There are several formal and informal systems that shape these conditions. Public health cannot address these upstream factors alone, so we work across systems to co-lead and drive collective impact initiatives. The Pasadena Public Health Department has embraced this approach and is collaborating with others to address the root causes of health inequities. We recognize collaboration as an essential element for designing interventions that can create lasting health improvements for everyone, and seek to engage the community to collect input and build the partnerships necessary for designing and delivering effective public health services.
Here at Young and Healthy, we're very dedicated to working with underserved and uninsured children to make sure they have direct connections to the medical, dental, and behavioral health care that they need. Pasadena Public Health Department has been instrumental in supporting our mission, and we have a long history of partnerships with them. We worked with them to develop a parent handbook, which we were able to distribute to families across this region, giving them vital information about child development. When the Affordable Care Act was passed in 2010, we collaborated with them to make sure that everybody in this region had vital information about how to access covered California, and continued to work with people to make sure that they were enrolled in these wonderful new healthcare opportunities.
I think it's an understatement to say that public health's main interest is to optimize the safety of our staff and our community. I think along with health records tracking and medical guidance, they truly do serve as a backbone of resources.
One of our primary functions together is to provide good messaging for the community about all of the potential and current pandemics that we're having, including COVID and of course Mpox. We are concerned about perhaps an emerging problem with Ebola, but most importantly is influenza. We are anticipating a big influenza year this year, and so that's really been a very important part of our dialogue between the two agencies for many, many years, is getting the information out to people so that they can be informed and protect themselves.
We work with them closely on things like water quality, on things like promoting programs like Rethink Your Drink, and encouraging the community to really embrace the safe water and high quality water that comes right out of their tap. Safe, reliable, and environmentally sustainable water and power are essential for maintaining the public health, and we're happy and always so thankful to have the opportunity to partner with the Public Health Department to advance our community's health and wellness.
Today, our team is committed to ensuring everyone has an equal and fair opportunity to be as healthy as possible. We are dedicated to promoting and advancing our collective health. Our teams provide public health education in the language of preference and meet our residents where they are, in their own neighborhood, home, or anywhere else they are comfortable. The Pasadena Public Health Department has positioned itself as a chief health strategist to engage members of the community and form strategic community-based partnerships. Central to the chief health strategist role is the need for an improved understanding of resident experiences and collaboration with community members and organizations working to improve those experiences. While a lot has changed since our founding in 1892, the department's focus on preserving and protecting the health of the Pasadena community remains as strong as ever. As we look to the future, we will continue to do everything we can to build trust so we can work with residents in partnership to build a bright future for all of us, where everyone has the opportunity to thrive.